The Nigeria Center for Disease Control and Prevention has urged state governments across the country to strengthen public health systems in response to the emergence of a new strain of the coronavirus in parts of the world. According to the Federal Ministry of Health, XEC is the latest in the list of past and current COVID variants being monitored as the COVID-19 virus naturally evolves. This directive comes after the strain, first identified in Australia, has now been confirmed in 29 countries. In its public health advisory, the agency emphasized the importance of ensuring that public health infrastructure remains responsive and resilient to address evolving health concerns effectively. Joining us in the studio is a public health consultant, Dr. Tuyi Meibanwadu. Thank you so much for joining us again on this
Good morning. A pleasure seeing you.
We are just recovering from the post-pandemic of the COVID-19. We've got the Omicron and the Delta variants of the coronavirus. Now we're talking about the XEC, maybe ZEC. How prepared are we? And looking at how we managed, how we're able to survive the previous strains of COVID-19 that actually wreaked havoc on the entire world.
Good enough. We should never lose the lessons we learned from COVID-19. It's still very fresh in our minds. And we had said severally that COVID-19 is now going away. It won't go away so soon. Why? Because you know that when COVID-19 came, we have variants, Alpha, Beta, Delta, and Omicron. Now we're having subvariants. This new ZEC is a subvariant of Omicron. There are about 5 subvariants of Omicron spreading worldwide now. Of course, this new one was first detected in Australia, going around the whole world now. So it's a new subset. But what we found out is that for now, it's classified as variants of interest. And what we're looking at is that it spreads easily, but we've not seen the severity. So it is important that we ramp up our preventive mechanisms. It's important that we ramp up our guide to ensure that both sentinel surveillance and genomic surveillance of these subvariants is kept we're kept abreast of it, so that we don't have a resurgence of a more severe COVID anyhow.
Right, and the federal government has said, states should be at alert, but it's not much of a big deal as at now, since it's still being recorded outside the country. But how reassuring is this, looking at the fact that we're in the festive season, we have people coming into the country and also leaving? Exactly.
That is why the alert is so important, because if you look at it now, Europe, Asia, United States, we're having those variants spreading already. And this is the first season you're going to see a lot of people coming from India, coming from Europe. We are trading with China. We're trading with United. We have connection with the United States. A lot of people are coming in, and that is why the surveillance is so important. Now, it's not just about tertiary hospital, but about every cadre of hospital services. People must be able to look out for those common symptoms and signs that may point to COVID. We have to actually, again, put together our vaccination to be able to, so that people can take vaccines and prevent the severe form of COVID. So we don't want to have a lockup. We don't want to have the kind of economic disruption we experienced and social disruption we experienced during the last COVID. It's important that, as of now, I'm sure we're better prepared. We're better prepared than where we were then, the first COVID. The basics is that we have to just keep telling people. We have to inform them. Doctors must be at alert. People must also be on alert and observe those basic universal health precautions like hand washings, covering your mouth, avoiding crowd. Those are still very valid, even post-COVID.
Well, I'm beginning to see, especially our lead producer, Nero Atiba, is already wearing nose masks. So that is talking to that is talking to how people are getting prepared. I do not know why he's wearing, but I believe that it might not be connected to what we are discussing, which is the ZEC variant. But could you elaborate on the specific risks this new strain poses to vulnerable groups, such as the elderly or the immunocompromised groups, especially those who are not exactly sure how they can protect themselves? Because I remember the non-pharmaceutical measures which were set to a lot of Nigerians to really imbibe, which is washing your hands, keeping physical distance and all of that. Could you help us, educate us on how we can protect ourselves before the government, thinks of how we can protect our people?
The basic thing is that, of course, the symptomatology is actually similar to those the COVID-19, the main COVID-19. Of course, fever, chills, runny nose, chest congestion, fatigue, difficulty in breathing, cough, sore throat, loss of taste. Those are classical symptoms. So if you now see people coughing frequently, of course, I sometimes don't ascribe it only to the weather, because I also observe seeing people with those kind of symptomatology.
Yeah.
If you see heightened symptoms relating to this, of course, it's a time to be actually, cautious. Then we must be able to improve or increase our testing capacity. Once you test someone for COVID and it's positive, of course, the testing kits are actually very affordable and available now.
That's right.
Once the person is positive for COVID, it's important that the specimen should be sent to Nigeria Center for Disease Control or any of the agency in the state, so that they can actually do what we call a genomic sequencing to know which of the variants is causing this problem. And then that reporting line becomes very important, especially if somebody you are at high risk, old age, preconditions, diabetes, hypertension, immunocompromised, people that are having anti-cancer drugs, reduced immune systems. These are factors that can actually help the spread of these variants we're talking about. So you must be able to know your risk, and then basically we shouldn't let down our guide in terms of hand washing, keeping some measured distance, avoiding too many crowd. And of course, when you know you are coughing or anybody is coughing, it is important that you put on a face mask to reduce the transmission of the virus to other person. So the basic fact is still that COVID-19 and its variants and surveillance are still very much around with us, and we must do something about it. We've seen that, regrettably, the vaccination has reduced significantly in Nigeria. We don't want a situation whereby it becomes a requirement before you travel to another country. So it is up to us now to rethink how to step up vaccination and raise the campaign for people to take those vaccines. Of course, all the rumors and the lies surrounding the vaccination is coming out to be utter lies, because I remember somebody told me that you took vaccine, you won't last how many months. So, unfortunately, regrettably, the person even died without taking the vaccine. So we should not allow.
But do you not think that, just like it's been said, we've had different diseases or different kind of things that are causing ailments over the years, like malaria, and it took several years. We have HIV and AIDS. They're talking about vaccination, they know vaccination. How come we had COVID in less than a few months? They're already talking about the vaccine. So do you not feel that it was quite reasonably justified by those who were skeptical?
Even if you look at IT, ordinary IT, the rate of development of new Windows technology is moving rapidly. Science cannot be left behind. Okay, if you look at even the space science, the rate of development and adoption of new technology is moving rapidly. Medicine cannot be left behind. The vaccines follow a certain protocol based on instruments available to us then to check the safety. But now it has improved so much. Really, if you want to see what people are doing in advanced countries, advanced scientific countries about medicine, you'll be amazed. A lot of things are being done. People are developing nanobots and all those things. When those things, technology comes up, we don't want to say that because, we used to, spend how many days for this, then we have to abandon the new technology. I tell you what, no country, take it from me, no country, not those countries, not especially some country, will allow a single molecule to be given to their citizens with that proper protocol. Because even the company will run underground. The country will run underground. Look at the management of even diabetes and obesity now. Ordinary one molecule developed by Denmark turn around the economy. Just one molecule, And then, so in reality, medicine is advancing so rapidly.
So you're saying that the conspiracy theories are founded, like, the like of, I don't want to mention them now.
I will even mention them.
Who are looking at, okay, we are having too many populations in the world. Global population is quite, overshooting. So we need to just reduce population starting from Africa, using some as...
How many people died in Africa? How many people died in Africa? At the end of the day, you want to reduce population in Africa, how many people actually died in Africa? But in reality, it's those people that are not having population that were dying. Higher deaths were seen in the places like Italy, US, India. Those are the people that were contributing the deaths, the casualty during COVID-19. So why would anybody want to reduce population? There are other measures to reduce population, to control, not reduce population, to control population. Everybody, because again, until we find ways of how to feed the world better, cater for the world better, make human being, a multi-planetary, beings, in such a way that, can I stay on Earth? Can I stay inside the moon? Can I stay here? So the challenge is how to make human being multi-planetary. So that is ongoing, of course, to some people who feel that the Earth may be. But again, we've not been able to sit down and look at how to, recreate our environment to take more people. Why would anybody want to put killing of people through vaccines? Medicine will not do that for you. Medicine will not kill human being. Never. Don't ever think like that. And of course, it becomes worrisome for some of us who is looking at dynamics, what's happening in America when Robert Kennedy is likely going to be the Secretary to Health, and this is the anti-vaxxers. The guy does not believe at all in vaccines, fighting against immunization of children and all those things. When those kind of person becomes, a global leader in healthcare, it's worrisome. But the world has to find a way to cope with or without America. So in reality, the anti-vaxxers or those people spreading those information should now sit down and reflect. In reality, what happened? Have we lost more people? The vaccines actually stop the spread of COVID. These are critical issues. But unfortunately, the dynamic of social media is energy. You spread certain rumors about this. You run on the energy. That one goes down. You pick another one. You run on the energy. It goes down. So that attention span and ability to forget is pervading now. Everybody, they forget things easily. So as it is, medicine will not be co-opted in killing people. If you want to kill people, go to the military or whatever, or even those people that
military don't kill people. Military kill enemies.
Enemies, yes. Right. Medicine don't have enemies. We don't have enemies. Doctors, we don't have enemies. Where you took a note to save life, you do all your working to save life, and development of drugs, vaccines, and co are veritable means of saving life. People are living longer, better now than it was 50 years ago. So what's the story about wanting to reduce population?
Well, the apprehension about the use of this vaccine, I think, is still going to be a big issue, especially when you look at some of the outcomes from the past 4 years that we've seen. Some persons have proof, so to speak, about how the vaccine has affected them. Maybe not directly, but at least to someone close to them. But you mentioned something earlier that you said Nigeria, we seem to be fully prepared if we are going to have something like this. And it's also coming at a time where the federal government is still managing outbreaks. Like we have Lassa fever, we still have meningitis, we have polio, we're still managing polio and all of that. Does it seem as though our hospital system is actually ready to have something like we had 4 years ago?
Well, again, you know that we improve our capabilities. Those days, ability to test for this COVID-19 resides probably in 1 or 2 places, but those one has been increased substantially. We'll be able to create biolabs, to respond appropriately. We've seen more companies, Nigerian, are manufacturing those syringes and needle now. See the attempt to actually manufacture vaccines here in Nigeria. So we're not as helpless as it was before. And besides, we have a great guy who is heading Nigeria Center for Disease Control now. So we are confident.
So Professor Ali Pate was in Doha and he said something like, saying that the federal government says trillions of dollars in stimulus money expended by world governments during the COVID-19 pandemic proves that global resources are available for intervention, but that it is now needed in the form of preventive and proactive investment in global health security. Do you agree with him?
Well, indeed. If you remember, many, many years ago, in this studio, I have propounded the Future Fund for Epidemic Preparedness as a response. Because, you know, when you want to really transform health, you have to follow the money. You need money. You know what it means to develop vaccines. You know what it means to deploy those vaccines and then, you know, apply it to people as it is. So you really need fund. Now, this fund will not be readily there if you don't create a future fund for epidemic preparedness. And then to address those emergency response. What we need to do is that proper application of those funds, because even it was so concerning that even during the pandemic, when we were struggling to get money, when people were donating money, people were still misapplying and stealing the money. That is just the worry, okay? Because if we use the money appropriately, you know, we will be able to respond better. So we have to really address the corruption in the application of money, you know, inflow in terms of aid or support. We have to address that corruption. That is very, very key. You know, secondly, Nigeria itself must be able to raise their standard. We as a country must be able to raise. How do we deal with epidemic preparedness in this country? Of course, you rightly mentioned the number of Lassa, this fever. Okay, we should have a clear maps. Outbreak time is coming up. What are our preparedness? Right now, medicine is not just about, of course, it's gone away beyond the four walls of the clinic or whatever, your hospital, or even the building of the hospital. Medicine is related to agriculture, related to climate. In fact, we're talking about planetary healthcare now. That is what we're looking at. It's related to even, you know, social behavior. You know, what is the influence of social media on the mental health of people? What is the influence on drug use? And how does this really affect their hearts and all those things? So that is how, you know, we think medicine now. And of course, the future of medicine is actually preventive medicine. We have to sit down and look at somebody and say, listen, in your lifetime, you need to check out for this. And that's where medicine is going. So in such a way that even before anything happens, you've really gotten, you know, to understand and relate to it.
But in talking about funds, you know, given competing public health priorities, is there a risk of over-allocating resources to this strain at the expense of other critical health challenges? How can we balance
It's public health. It's not, listen, the future for epidemic preparedness, it is a global initiative. Different countries are contributing because once you have a shockwave in this part of the country now, it affects everybody. Look at what Wuhan did to us. If a virus jumped from a bat to somebody and then the whole world picked the whole thing, and we're here, you know, cost people some election, a lot of people died, and all that, economy grounded worldwide. So we know that once a Lassa fever strain, you know, a very mutant strain jumps out of Nigeria and enters, say, UK, we may be in trouble. The world understands that. And the best thing is actually, you know, we have a kind of response system. Of course, WHO is trying to get that done, but we just hope that America will not wake up and pull out of WHO, and then WHO will be defunded again. The thinking is such that you must be able to be resilient enough. You, as a country, as a Nigeria, you must be resilient enough, build up your local. Of course, I've always said it, the lowest hanging fruit for us is what we are doing. We sit down here, we discuss critically what are we going to do. Then we seek this information to the community. In a community, maybe, you know, remote Savara or whatever, how does this community understand the global, the health threat they are facing? Is it meningitis? Is it in Erurua? Is it Lassa fever that is the threat? Should they respond? The farmer must be brought in, the epidemiologist must be brought in, the people that are slaughtering animals must be brought in, so that we don't, I mean, that is the kind of response and resilience we need to build. Now, when you are talking about impact on other competing societies, everything would come down to head. When your housing system is poor, you get bad health. You get overcrowding and you get all those diseases spreading to you. When the water system is not working, you get waterborne diseases. So even when your road is bad, you get accidents and get up. So in reality, there can't be too much money you apply to health. You've seen that even the Abuja Declaration of 2000 that said, okay, you guys, 15% of your budget to health. We are not doing 5% out of that. So we can't start talking. Whereas countries like Rwanda is doing even far above that, Botswana is doing far above that. But we are not doing 5%. So now get to 50% before we start talking about over-allocation. So competing interests, but competing interests will have to actually dovetail into health. Health is not just about being well, it's about your economy. Health is about your GDP. Health is about even the decisions, political decisions. Health is, entry deeply into your political capability of every country.
The life expectancy of the entire population.
And right, that you also mentioned how, states, the federal government said states should be on alert at this time. And we're also talking about the role of state in ensuring this. You mentioned disseminating information, especially to villages, small communities, and all of that. I'm very concerned about the role of state in this, because if you look at what happened in 2020, we could see some governors themselves even speaking up against the use of the vaccine, speaking up against even the COVID-19 itself. When those who lead the state are not, living in the reality of the situation, how much more communities, villages that do not have access to power and other sort of information?
Olamide, sincerely, is so concerning. I remember when the judge was ravaging the north, and the Zamfara government came and was saying that because people they were committing adultery and fornication, that was why we had it. It was a very challenging thing. So what we need to do, I will challenge the health commissioners and the permanent secretaries in different ministry of health in the states to actually be up to work to, further enlighten their governors in terms of what they need to do and what it means as far as health is concerned. We have to drop it on their laps, because you can only speak from the depth of your understanding. And for instance, if you are confronted with an unknown, something you don't understand now, let me tell you how human being behaves. If you are confronted with something you don't understand, you will use what you understand to explain what you don't understand. And that's the beginning of ignorance. That's the beginning of ignorance. We must be able to get, at least at that level of functioning, we must be able to get to a point where we know that I am born mortally ignorant and I'm ready to get a new education, as this because I'm relating to the whole of people. It could be so depressing that governors would themselves come and, create misinformation, disinformation on critical public health issues. And of course, we should be able to get to a level where, if we are not getting that kind of traction at the level of the state, there must be a pool. From the National Council of State or from the, of the state governors. Of course, we have governors forum doing beautiful things, trying to deal with hypertension and diabetes, 10 million things that's ongoing now. For me, I can know. I'm sure a lot of people may not know. Me, I know that. But how far are they communicating this kind of information? So we need that, not just at the state level, a pool, and even the governors forum, a pool at the Federal Council of Health, to National Council of Health, to address those kind of misinformation at the level of federal, sub-nationals. We just have to keep talking, and besides, I know that to a large extent, a lot of help, financial help or inflow to state is controlled by as much as how well you do in trying to tackle those critical health challenges. So it has to be like that. But we should not allow any state governor to spread misinformation.
That's right.
NGO, media, National Council of Health, this Governors Forum must be able to rally around and tackle this kind of thing.
Well, NCDC has actually got its job cut out for it. But then what role does genomic surveillance play in detecting and managing such strains, and how well equipped would you say Nigeria is in this regard? We saw the role Lagos State played during the COVID pandemic and all of that, and some other states, but we also saw how the mighty fell at the time. So are there partnerships or resources that you think are there that can strengthen these capabilities?
Well, now, let's look at the two surveillance. One is Sentinel. Sentinel means that symptomatology, we're suspecting COVID, and thereby we run a test, and they're okay, COVID positive. Genomic means that you have to actually break down the type of COVID. What type? Am I dealing with? Is it resurgence of Alpha, Beta? Is it Omicron? Is it subset of Omicron? That's the genomic thing. Of course, these are very technical things to do, but good enough. Nigeria has quite a number of partners. Of course, these things, it's coordinated. WHO is involved. different foundations. Gavi is involved. Even in Nigeria, Institute of Human Virology, Nigeria, which is a very wonderful initiative. Institute of Human Virology in Nigeria is doing a lot of work in trying to, deal with this. I'm sure they just recently opened a big laboratory, to do genomic surveillance. And then even the Nigeria Center for Disease Control is opening biolabs, trying to, spread the biolabs beyond the traditional place it was during the initial outbreak. So, in our own way, partners are helping, government is listening, and we just hope that the citizens, because now you can have a very effective formula, like vaccine is very effective, could be very effective, 90-95% prevents this disease, but it may not be efficient. You may have it and people will not take it. You can only get result when your product gets to the people and they believe it and take it, and then the disease, then you can then control the disease. Yeah. No matter how great the product is, if people refuse it, what are you going to do?
But some will always give the report that when I took the vaccine, I was almost paralyzed. I had to take certain drugs to be better again and all of that. Some are taking 2 shots and others did not even go for the booster shots. How do they position? How do you think this might impact them if eventually we have this in the country, God forbid?
Biology is not mathematics, okay? But rest assured, somebody like me now, I cannot use perfume. But a lot of people can use perfume. It doesn't mean that I'll now go and conclude that perfume
it's bad.
Is, when you take perfume, you have to sneeze, this and that, So it's biology, it's human body. What medicine does is to take a lot of people and look at it. If 100 people take this vaccine, will any of them have challenges with it? If 99 people are having good report with it, they will now find solution to the 1%. But when we use one eye narration to describe the whole thing, it's just like all this story that, that all Nigerians are corrupt. As a science person, you have to show me evidence. Yeah. Or you say that all Nigerians are fraudsters. They are criminal, they are ritualists.
That's right.
You cannot use that to characterize a whole lot of people. We don't do that. But in science, even more, your dealing must be deepened, must be more exact. Tell you what, all those symptoms that people are talking about, it's like when some people take ordinary ibuprofen, they have stomach pain. If you take some
I guess swollen eyes.
Swollen eyes. Yeah. Does that mean that ibuprofen is off the table? Some when they take ordinary Septrin, they have all these bumps. But that is one of the most wonderful drugs. So we can see those kind of biology playing out in some very small population. But when we're talking global, generally, it's a protection. I took my doses complete. I am still here. How many
years? As a healthcare provider, definitely you will take it.
I'm still here.
Well, thank you so much for your time. Public health consultant, Dr. Tuyimi Banwodu. It's always a pleasure to have you, discuss this very crucial matter. Thank you so much.
It's my pleasure, Ben.
Right.